Fee-Nye, the Transhealth guy.
Fee-Nye, the Transhealth guy.
Fee.
Andrea is a 24-year-old transgender woman who sustained a C6 Asia D spinal cord injury during an MBA. Currently, she is debating continuing with her hormone replacement therapy, as she is unsure whether it will interfere with her spinal cord treatment. In addition, she is frustrated with the clinical staff as they continue to use the wrong pronouns. For the purpose of this video, we are going to focus less on spinal cord injuries and focus more on the psychosocial aspects of this case.
Hello? Okay, sounds good. Yeah, we'll book you in. Okay, bye. A man just phoned the clinic saying that he has a spinal cord injury, an Asia D, and he wants to book in an appointment, so I put it in our schedule. Okay. Hi, do you have an appointment?
Yeah, my name's Andrea. I called to book in earlier.
Let's talk about assuming gender. The first point of contact with your patients is often over the phone. Assuming gender is a great way to skew that relationship that you have with your client on first impressions. Appropriate training goes a long way. There are many resources and organizations available, even here in Ontario, like Rainbow Health Ontario, that will train all members of your clinic. Unfortunately, testosterone blockers and other hormone treatments don't actually have an effect on their voice after puberty and other physical traits, which actually contributes to a patient's gender dysphoria.
Okay, great. So we've worked on bed mobility and balance sitting, so we're going to move on to sit-to-stands. Jess, would you mind facilitating at his quads and glutes? Mm-hmm.
Her quads and glutes.
I'm sorry?
You misidentified me. I go by she, her pronouns.
Misusing pronouns is more than just using the wrong words, and has a significant impact on their gender dysphoria, which contributes to the feelings of discomfort and unease that draws attention to the difference between their sex and their gender. It also has a tendency to undercut the therapeutic alliance that we've been working so hard to build. Maybe communicate with the rest of the team prior to treatment to see if that helps.
I understand that you're sorry, and I appreciate it, but this has been an ongoing problem in my treatment and has been really frustrating.
Thank you for bringing this up with me. I really appreciate you being so open. And we'll talk with the other team members and make sure everyone's on the same page to make sure the environment is as comfortable for you and other people from the LGBTQ+ community as possible. Okay, so we've done some pre-date stuff now. We're gonna work on some walking. SC, would you mind coming over and facilitating Andrea's pelvis here?
Sure.
As you can see, it can be really uncomfortable for the patient to have this many people in their personal space, especially in areas that they're sensitive. In Andrea's case, she's already really frustrated and uncomfortable with the healthcare team members that she's encountered so far. So we need to make sure that the client is comfortable before, during, and after the treatment with the healthcare providers to make sure that everything is up to par, and with the areas that they're facilitating. So let's try that again.
So we're gonna work on gait now, and it would be beneficial to have another therapist with us to maximize facilitation and optimize your recovery. Are you comfortable with this?
Sure.
Esty, would you mind coming over and helping facilitate at Andrea's pelvis and glute area?
For sure, of course.
So, Andrea, this is Esty. Esty, Andrea. Hi. She'll be helping us out. Are you comfortable with that?
Yeah.
Okay,
Great.
wonderful. So Jess and I are going to be facilitating at your buttock and pelvic region. Now we understand that this can be a sensitive and uncomfortable region to work within, so please just let us know if you're comfortable with that.
Okay, that's fine.
Okay, wonderful.
And shift your weight on your left. Good. Swing through. Stand tall and shift onto the right. Beautiful.
Hey Andrea, how you feeling?
I'm actually feeling really tired.
Okay, let's take a quick break and regain our strength.
Let's talk about exercise prescription with someone undergoing hormone therapy. There are actually a number of side effects that are associated with this, including dizziness, shortness of breath, decreased strength, And these can all impact our treatment plan and how we do the exercises. Let's take a look what's happening during the break.
I've actually been noticing the side effects of my hormone replacement therapy have been interrupting with my treatment sessions. I'm actually considering stopping my transitional medications because of this.
Oh wow, that's a big deal. Have you talked to your doctor and endocrinologist about that?
No, and I know it's important to do that, but do you have any advice about my medications?
I'm sorry, it's not my area of practice, so you get better advice from your doctor. I'm willing to work with whatever they say and make any changes needed.
Okay, that makes sense.
So are you gonna get top surgery?
Wow. Well, asking questions is, of course, a very important part of what we do with our patients. There is another scenario where we have to find the proper line and distinguish between asking questions and being overly curious. These types of questions actually sensationalize a trans individual's experiences and is rooted in transphobia. Would you ask somebody if they're going to get a breast implant? No.
So how are you feeling about doing some walking now?
I think I'm good to go.
So what we were thinking is using a mirror just for some visual feedback, and it would just help you gauge where your body and how your body's moving in space. How do you feel about that though?
While mirror therapy may seem like a normal and harmless facilitation technique, having an individual confront their appearance may actually increase their stresses that are associated with gender dysphoria. Therefore, like they did here, it's a really good idea to check in with a patient, make sure they're comfortable before going forward.
At this point in my transition, I don't know that I'm comfortable looking in a mirror.
That is completely okay. We'll just try something else.
Hey there. Before you go, here's just some extra tips and considerations. Number 1, try to make your clinic and work area as inclusive as possible. Pronouns on name tags, gender-neutral bathrooms, as well as multiple gender identities on your intake forms, and safe space stickers go a long way. Number 2, it's important to consider side effects of gender-affirming practices such as tucking and chest binding. These may increase an individual's risk for things like pressure sores and difficulty breathing. They may also contribute to symptoms of autonomic dysreflexia by causing a noxious stimuli. Here comes treble. Practices like pelvic floor, physiotherapy, and catheterization can be very effective, but make sure that your patient checks in with their mental health professional, because these practices can lead to feelings of unease because it can contribute to gender dysphoria as well. Last, but certainly not least, number 4, be aware of resources you can direct your patients to. Sites like Rainbow Health Ontario have really invaluable resources, as well as databases that your patients can access for other non-discriminatory clinics or healthcare practitioners. For definitions and more information on physiotherapy as relates to gender confirming care, check out our fact sheet as well as the other resources.